healthcare leaves a room for a lot of ego. There's a lot of ego in healthcare of I know this, or I have this particular degree, so I should just automatically be trusted in this, or I as the provider of care know more about you than you do. And that's not true. And I think once we begin to dismantle that idea of privilege to other people's bodies, then we can really get to like the heart of, well, how do we actually construct a system that is not to boost up my own ego, but is really to utilize the information that I have and know and can assimilate to assist this person.
Hey, you guys, thank you so much for tuning in to yet another episode of the Culture of Health podcast. Before we get into this episode, I want to encourage you guys to like the podcast if you're watching on YouTube, subscribe, and share with a friend. That is how we're going to continue to spread the message of good health. As you guys know, we're trying to build a better culture of health in this country. And the only way we can do that is by educating ourselves and educating each other. So, in the name of education, in that spirit, I have a friend here on our podcast today, and we're about to get into the weeds about the healthcare system, everything that might be going wrong with it from a discrimination standpoint, what prevents people from accessing care, and more importantly, how you can learn how to advocate for yourself within this system until you become healthy enough to where you're not relying on it. So with that being said, I'm going to introduce our guest. Her name is Vivian. She is here to represent Earth Belly with you guys, which you guys will hear about later on in the episode. She is a healthcare professional, has been so for several years. She is a mom, probably most importantly. And she's a friend of ours. And she's also, just as much as we are, passionate about health and everybody having equal access to it. So with that being said, Vivian, welcome to the podcast.
Hi.
Thank you for joining us.
Thank you so much for having me.
I'm glad to have you. So before we get into all the things, let's talk about you for a second. You are a lot of things, but how would you describe yourself to the world? People don't know who you are. They're like, who's Vivian? Tell us about yourself.
That is a loaded question. Like you said, I'm a mom. I work in healthcare, but ultimately, I think I'm a healer. So, I'm really excited to be here today to talk with you about some of the limitations of our healthcare system and how to educate people to advocate for themselves, so that way they can have a better experience and ultimately live a healthy life.
Right. So it's one thing to we can all open up a magazine, scroll through social media, and you can see secondhand some of the limitations that we have in our healthcare system, but you've experienced this stuff firsthand.
Yeah.
So how has that kind of shaped your passion for wanting to get to the root of it?
Working in healthcare, I've really had the opportunity to be in people's lives in a moment where they're the most vulnerable, and having that, I don't want to say power, but having that privilege, really, that's what encourages me to make sure that no one's being taken advantage of in that situation. So working with women, I've worked in high-risk perinatal spaces, and pregnancy in and of itself is a time when women are vulnerable, especially like right before birth. And where the system begins to break down, I think we see the victims are typically women, and more specifically women of color.
Right. And that's a hard thing to grasp, right? Especially when you talk about racism in the system. We know that racism is baked into the American experience in a sense. But then when you talk about access to healthcare, most people, and even me, I'm guilty of doing this in the past. When you think of racism in the healthcare industry, you think that the caregiver, the person that is administering care, is racist. But I think that it goes a little bit deeper than that, right?
Yeah, it goes way deeper. There are lots of people with really great intentions in the healthcare system. Doctors, nurses, techs, just wonderful people. But when the system itself leans to support disparities, then if a person is not mindful of their biases, or if they're not mindful of, I think that's the word, bias, if they're not mindful of that, then they can unintentionally be very harmful. And so it's bigger than just one person. It's bigger than just how, even though it's important how one person treats you, how your nurse treats you, how your doctor treats you and listens to you. It really is, how does the system catch the bias? And I think that's what we want, is a system that will catch the bias. Like, okay, the person can be biased, but we want a system that's not going to let that bias fall through the cracks and ultimately harm you as a patient.
Right. Well, what are some, like, not too specific, we don't want to get into any, like, names and things of that nature.
Of course.
But how exactly is the system falling short when it comes to not addressing the issue of, I guess, is it prejudice? Is it like, what exactly is it where the system is falling short? What are some examples? Like, what are you seeing in this industry where it's like, hey, this is a problem and it needs to be fixed?
I think, well, I can only speak from my experience.
Sure, yeah.
I think it really comes down to the person who is in the position of being a patient, knowing that they have autonomy in the position as a patient, that basically you are a paying customer and that you deserve to speak up and you deserve to be heard. And also having providers of care that are willing to believe what their patients are telling them. So, sorry, go ahead.
Is there like where is it? Because I can imagine, I'm not a healthcare worker, but I can imagine if there was somebody who walked into the emergency room and they looked like they didn't have access to resources, and they're saying that they're feeling all these things, and they don't present themselves as, or they don't look the part of someone who's credible. I can see how that might lead to them being denied, like, the access to care. Is that kind of like?
But my thing is, what happens when what does look the part mean?
That's really what we're getting
So
at,
does look the part mean white?
Right.
Does it mean, like, what does that mean? Because a lot of times you could be a highly educated woman and you're making six figures, but you present to the hospital setting and you're literally battling people's biases through no intentional fault of theirs and no fault of your own. Like, for example, I took care of a woman who had just delivered. She had been readmitted, and her mother was with her, and they were both very adamant that they believed that when they had surgery, something was left in. Because of her symptoms, she would not stop bleeding. She had so much pain, really severe abdominal cramping. So she was convinced that something was left in. I started my shift. My shifts at that time were 12 hours. It wasn't until almost the end of that shift that it took that long for the doctor to listen to her, to believe her, and then to run a test. Took almost my entire shift for that to happen. And to be completely honest, it wasn't even the doctor that she had started with. It wasn't because they changed shifts. She requested another doctor, and then that doctor then ran the test, and then they found that they did, in fact, leave something in her. So she, by all accounts, from my perspective, she looked together. She was quote unquote well-spoken. I mean, there was nothing looking at her that let me feel that she was that she was not credible or not able to articulate what she was feeling. But that's, to me, I don't know what that other doctor saw. I don't know if it was ego. I don't know if it was bias. I don't know what. But it's just watching that fight. And had she not had that persistence, that fight, and the support of her mother with her at that time, she could have very well gone home and potentially died. Yeah.
So I think I read a statistic. This was several years ago, but I think it was hospital mistakes are among like the top 5 causes of death in this country. Does that sound right?
I mean, I mean, yes, I've heard that. I've heard that statistic before. At the end of the day, it's people. Sorry, it's at the end of the day, it's people taking care of people.
Right.
So I think what that ultimately translates to is, if you are the person in the position of giving care, how willing are you to not only educate yourself on whatever it is that you study, whatever your specialty is, but how willing are you able to grow as a person, an individual, to ensure that you are giving the person that's presenting in front of you in need of care the best that you can give them. And not saying that mistakes are not going to happen. Unfortunately, they do, because we are humans.
Yeah.
But I feel like a lot of those can be eliminated or greatly reduced if we're able to check our biases, check our ego, and really get to the root of how do we care for the human being in front of us.
Yeah. What are some of the barriers that are like presented? Because I don't know, I'm the type of person that believes that everybody wants to do the right thing, right?
Yeah, I agree.
What are some of the things that are presenting themselves as obstacles for people in your position who provide care to other human beings? What's preventing them from, like, what is it? Are people like overwhelmed? Is it working too many hours? Is the workload too much? Like, what's going on in the healthcare system that is preventing us from administering the level of care that we deserve?
I think the stressors that you mentioned are all true. Yes, the workload can be heavy. Yes, it can be stressful. These are valid, I think, not only in the healthcare industry, but in other industries as well. I think that's a really big question. I think part of it is, how do we get, healthcare leaves a room for a lot of ego. There's a lot of ego in healthcare of, I know this, or I have this particular degree, so I should just automatically be trusted in this. Or I as the provider of care, know more about you than you do. And that's not true. And I think once we begin to dismantle that idea of privilege to other people's bodies, then we can really get to like the heart of, well, how do we actually construct a system that is not to boost up my own ego, but is really to utilize the information that I have and know and can assimilate to assist this person? Like, how can I be of assistance to them rather than they are the ones in need of what I have?
I'm sorry. That was a bar. Okay, so I gotta repeat that. So, did you guys know that I used to be pre-diabetic? Yeah. I was a broke college student at the time, living off of ramen noodles, peanut butter jelly sandwiches, and a lot of candy. And I mean a lot. So it's no surprise that I was on my way to becoming diabetic. I don't exactly regret it, but if I could go back in time, I'd do two things. First, I'd slap myself. Then I'd start using Levels. Levels is an app that uses continuous glucose monitoring to show you how food is affecting your health. That might sound complicated, but I promise it's simple. You see, your glucose is fluctuating all day, and it's primarily due to what you eat. If you can manage to improve your diet based on the feedback you're getting about your glucose levels from the app, you may notice that you'll have sustained energy, sharp memory, healthier weight, and a host of other benefits that we could all probably use more of. Here's how it works. When you sign up, you receive 2 sensors that last 14 days each. After applying the sensors to the back of your arm, you begin receiving instant feedback about how your food choices are affecting your glucose levels. It's a level of accountability that's completely changed the way I eat, which has completely changed the way I feel. If you're ready to accept responsibility for your health and ready to learn more about your body, I can't speak more highly about what Levels is building and how they're helping thousands of people see how food is affecting their health. If that sounds like something you can use in your life, I've dropped an affiliate link in the description of this video, and if you sign up using that special link, you'll receive an additional 2 free months on top of your annual membership. I just ask that you do one thing. Keep me posted about your experience. I'd love to hear all about how Levels is helping you improve your metabolic health. Have you ever had a hard time keeping up with your supplement regimen? That was a rhetorical question because we all have. Some supplements are supposed to be taken once a day, others twice a day, and even 3 times a day. By the time 5 o'clock rolls around, you can't even remember what you already taken. When it comes to any supplement, finding one that's high quality is just as important as finding one that's easy to implement into your daily routine. And I gotta say, it's so nice to finally have something that checks both of those boxes. Oh, you ain't know? I'm talking about AG1 by Athletic Greens. One scoop of AG1 delivers comprehensive and convenient daily nutrition with 75 vitamins and minerals, and even includes probiotics and digestive enzymes. I've been able to easily turn this into a habit by stacking it with something I do every single morning, which is eating eggs. While my eggs are scrambling, I'm sipping on some AG1, and by the time the eggs are done scrambling, I've done something to improve my gut health, immune function, and mental clarity. How's that for a good habit? This happens every single morning. So when the day takes off and I'm running from one thing to the next, I have peace of mind, knowing that my body has already gotten what it needs. Habits, ladies and gentlemen, it's all about habits. And having the right habits is how you take ownership of your health. By the way, if you want to take ownership of your health, now is a good time to start. Athletic Greens is offering you a free year supply of vitamin D3 and 5 free travel packs to go along with your first purchase. All you have to do is go to athleticgreens.com/TCHP to have access to that exclusive offer. Again, that's athleticgreens.com/TCHP. You basically just said in a nutshell that ego in the healthcare system, because of the I know more than you type thing, that you kind of have to follow my rules. And what's interesting about that is not just in like a hospital setting, but even like as like a primary care physician. I used to work at a primary care office geared specifically towards seniors. And they would come in and complain of, this or that, not wanting to take certain medications because the certain medications make them feel some type of way.
Yeah.
But the doctor's like, listen, no, you're going to take this medication because X, Y, and Z, I know more than you, basically. Yeah. What's interesting about that is, and something that I stand on wholeheartedly, is in order for that system to work, in order for that to improve, patients need to be comfortable standing up for themselves.
Yeah, definitely.
That's really one of like the biggest questions I have for you. With your experience, what are some ways that people can learn to like advocate for themselves in this system? Because let's face it, like if I'm sitting across from someone, let's say you, for example, and you're more educated than I am when it comes to a lot of things. If you tell me something, I'm more inclined to do what you say. But how do I empower myself to where I can actually feel comfortable saying no,
I think what you just said is the crux of it. I think we have to get out of the mindset. This isn't back in the day. Not saying that back in the day was great, but this isn't back in the day like, oh, this is my doctor so-and-so, and they've been my doctor for 50 years, and whatever they say, I just believe it because they're just so great. And they have my best interest at heart. One is you always have your best interest at heart. No other person on this planet, whether it's a doctor, sister, friend, cousin, you have your best interest at heart. So, that was number one. Sorry. I don't even know what number two is. So I'm just going to kind of go on like with what I was going to say.
Let's expand on number one.
So let's expand on number one. You ultimately have your best interest at heart. So that means even if you don't have the educational foundation to eloquently argue why you don't think this thing is best for you, that doesn't mean that you still don't have validity in what you feel and know about yourself. And you but should be. And I encourage you to be empowered to speak up, because the women that I took care of, she wasn't a doctor. She wasn't a nurse practitioner. She just knew something in her body wasn't right. And had she not continued to say, hey, there's something going on here. Hey, I feel like you missed something here. If she stopped doing that, she could very well not be alive. So please know, whenever you go to whether you're getting your hair cut, you have to be the one to say, hey, I think you're taking too much. Hey, I think you're doing too much back here. Like, personal experience, you gotta be the person to speak up.
Hey, well, we all got a homie or been through a situation ourselves where you're sitting in a chair and your barber jacking you up.
Yes.
I don't have that experience. In case, Jordan, if you're watching it, hey, boy, we good, bro. But that's so true.
Yeah.
Because, again, it's this feeling like, well, you're the expert.
Yeah. And that's like you sit in the chair, like even me getting my hair done. I've had a lady cut my hair super duper short. I'm like, I thought this was a trim. They're the expert, but you are you. You are always going to be the expert in you. That's it. I got chills.
Hold on. You are always going to be the expert about yourself.
Yeah.
There's a phrase that I've heard tossed around in the functional medicine space. It's I think it's self-led, but it's like self-led healthcare in a sense. Yeah. Whereby people can, instead of going to your doctor to get all the information about your body, you can go to this lab to get your lab test here. And then you take all this information you gathered about yourself, and then you consult with all these different sources to help you build like a holistic picture about what's going on.
Yeah, I think what you said is the key word. Whenever you go anywhere, remember, you are hiring them as a consultant on your care case. You're hiring them. Whether you have insurance, whether you don't, you're hiring them because they're going to get paid whether you have insurance or not. It's going to happen. So always going with the mindset of, I'm hiring you to do a job. Now, that doesn't mean you have to be rude or arrogant, but know your power in the situation. They don't get to just do whatever to your body, because I think it ultimately comes from a mindset of the body is somehow broken and this is how I need to go in and fix it. You're presenting as a patient, as a fully actualized person, unless you're a child and then you're the parent advocating for that child, but you're presenting fully actualized, and you are asking them, what do you think about this? And now they may have a strong opinion based on their research and their study, which is fine, which is good, because we need them to have studied and followed the research and have a succinct recommendation for certain ailments. But ultimately, the power lies within you. You are the one who's going to give them permission or not to follow a plan of care on your body. And it's really the mindset that you have when you walk in that, hey, it's me. I'm hiring them to work for me. And That's how you have to think of it. It may seem a little extreme, but that's how you have to get out of that mindset of, oh, it's just whatever they say. I just want to be quiet, so maybe they won't hurt me if I'm just quiet and really agreeable.
So in the spirit, if you think that saying that you hire your doctor sounds extreme, what about in the case of having to fire them? What are some, like, I'm kind of putting you on the spot here.
Yeah.
But what are some, like, telltale signs where it's like, you need to fire your doctor?
I think if you are verbalizing what you need, and the provider that you are speaking to is one, if they are not hearing you, or you feel like you're not getting what you need from them, then you can fire them. I really want the mindset to be just like if you were to go to a store, you had a personal shopper, you didn't like the clothes that they were picking out. I know this is different. It's your health and it's not clothes, but the mentality is the same. It's not to belittle the value of your health and the knowledge that they could be bringing to you, but it's the mindset that you have to have, because at the end of the day, you are responsible for you. They aren't. So you should fire if you feel like, hey, I've asked you for this. I've asked you multiple times. I'm telling you that this is what I'm experiencing, and none of my plan of care has changed to align with what I'm verbalizing to you that I need, then I don't think you're the person for the job, unfortunately.
Right. So if someone does take that step and they're like, you're fired, right?
Yeah.
In order to do that, you have to have a certain level of comfort with navigating yourself through taking care of yourself.
This is true.
How can we, like, what are some, like, beginning steps? And I've actually just recorded a podcast called The 4 Steps that you can follow to take ownership of your health. And it was just published. So if you're listening, you should check that out. But I think that you can offer a different perspective, because I'm not a healthcare worker. I don't have the level of experience that you have dealing with patients, and knowing like what their level of knowledge is about their bodies. What are some ways, practical ways, that people can feel comfortable taking ownership of their health to where they feel comfortable saying you're fired?
I think the number one is mindset, like we just talked about. I think you have to change your mindset when it comes to healthcare, so that way you feel comfortable standing in whatever your truth is.
Mm-hmm.
Two, I think it's important to research. If you have time and you've been given a diagnosis, you can do your own research. There's Google Scholar. There's, I think, National Institutes of Public Health. I forget the acronym, but there's lots of free data that you can research yourself, public data that you can just research, because you have a brain that can critically think. You can exercise your reading comprehension, and you can ask educated questions to your doctor. So one, research. And then two, like three, not only research the disease process itself possibly, but also, well, what doctors in the area or mid-levels like nurse practitioners, physician assistants are offering the type of care that I feel like aligns with me. So what does that mean? So does that mean, okay, let's say I started working in oncology. So let's say, okay, I want a very traditional, I expect that the type of cancer that I was diagnosed with, I expect that I will have chemotherapy, I expect that I'll have surgery, and I expect that I will have radiation. And you're fine with that. So now you feel confident and say, well, let me find, don't just go to any place. Let me find, what doctor do I want to handle my case? Let me do research, not just word of mouth. Let me do research on the actual provider that's going to be listing out the plan of care. Or if you say, you know what, I want something different. I think is there a natural approach? Are there herbs that could help out with this? I don't know. Research that and see if there is a space that's offering the modality that you're looking for. Because ultimately, you are a consumer of this product of healthcare. And the more educated you are on the product of healthcare, I feel like the more you'll get out of it and the more confident you'll be when doing it.
Bars. So, that's like, what's up, you guys? So, what I'm about to tell you is really important. And you'd probably take it more seriously if I was a little bit older, like 28 years older. So, hang on.
Okay, this is better. All right, look, as much as I talk about health on this podcast, one aspect that's often overlooked is health insurance. I know. You think it's expensive, but I promise it doesn't have to be.
What are you talking about, Dad?
I'm trying to tell them about insurance.
Oh, man, do your thing.
My name is Eric. I'm with Access Benefit Consultants. I've been insuring families since Austin was a baby. Our agents specialize in helping independent contractors get covered with health insurance.
Wait, I'm an independent contractor. How much you think it'll cost me?
Man, we help people get covered for little or nothing. It depends on a few things. And I'll tell you what, why don't you just head over to our site? You can either call us, set an appointment, or generate your own quote. And tell your mom and them to call us as well. They need someone they can trust to go over their plan. And we're those people.
Hey, you guys, we really appreciate you tuning into this podcast. And I want to ask you a question real quick. Do you always trust your gut? We hear all the time that we should trust our gut, but can we actually trust it? Well, it depends on your gut health, because your gut and your brain are actually intricately connected, and how you see, feel, and experience the world is influenced by the signals being sent by your gut. So if your gut health is off, it may not be trustworthy, and that's why supporting your gut is one of the most important aspects of improving your overall quality of life. You can do that by getting enough fiber in your diet, but let's be honest, that's not always easy when you're busy or when your kids are picky eaters like some of ours. That's why we love using Fiber Mix by Supergut. The resistant starch fiber feeds the good bacteria in your gut, decreases the population of bad bacteria, and can help you feel full, sustain healthier weight, and even improve your blood sugar. Personally, my favorite thing about the powder is that you can mix it in just about anything. One time we put it in the kids' spaghetti and they had absolutely no idea. They even complimented us after finishing it. Supergut's Fiber Mix is an easy way to kickstart your gut into being a more trustworthy co-pilot for your brain. If improving your gut health is a priority for you, which it should be, I highly recommend you check out Supergut's Fiber Mix. I left a link in the show notes for you to check out this dope product and some of the other cool things that they offer that help you improve your gut health. All right, let's get back to the podcast. So when you look at this from a systemic perspective, I don't think that systemically we are doing a great job of putting the power in the hands of the people, but I think that a top-down approach, it has to start obviously with the institutions that qualify the people who provide care, but then also with the caregivers. Like, how can we, in your opinion, what would you say? Because I'm sure that there may be a few caregivers listening to this episode. What would you say to them to galvanize them to help them empower the people that they're taking care of? How could you inspire them to become, pushers of power onto the people?
Pushes the power onto the people.
Put the power in the hands of the people. How can we do that?
That's a good question.
I know. It's tough.
It's a good question. Yeah, I think I'm going to answer that by saying I think really great providers come from a place of sincere compassion, sincere concern, and education. And I feel like the great caregivers that I know, once they know something, they want to empower their patients to get the best of whatever is being offered. So I think ultimately a great caregiver wants to be there. Like, they want to be in the field that they're in. They're not doing it for a paycheck. They're doing it because they really believe in the change that they're making in people's lives. And if you are a caregiver and you are presenting and making change in people's lives, I would just, I don't know where I was going with that. Train's gone. Train left the station.
Let's go.
Woo.
Let's go take it to another stop. I want to know. So another thing that I'm passionate about is prevention, right?
Okay.
It's like there's a quote that says, "An ounce of prevention is worth a pound of cure." And so how can we what are your thoughts on the healthcare system's approach to disease, weighing food and lifestyle change versus the admission versus the prescription of medicine? What do you think the balance is from your experience when a patient comes in and they're experiencing some things? Is nutrition ever a part of the conversation when it comes to the care that's provided to the patient?
I would say sometimes. I feel like more than it used to be, but in my personal opinion, not enough.
Yeah.
And going back to what you said earlier, that is a way to empower yourself in your healthcare, or taking full control of your responsibility for your healthcare, is what are things that support health? And what can I do right now to just support the health of my cells and my body? And there's so much free information out there, just free information, where you could find access to, diabetes, I need to exercise more. Okay, type 2 diabetes specifically, I need to make sure that I am a part of some type of aerobic activity so that way I'm not as insulin resistant. Oh, wait, I need to cut down my sugar intake. Oh, wait, I need to go back and listen to the podcast about sugar.
Drop that.
But I'm sorry, we're back. But taking control of your health and the things that you have, what's it called? Modifiable and unmodifiable risk factors. So we're kind of going on a tangent. So if we're talking about type 2 diabetes, that's basically a diabetes, a condition of lifestyle. So that means if you are able to research and learn, okay, I need to change what I'm eating. I can modify that. I can change how sedentary I am or not. I can modify those things. If you start to implement that, then you are in control of your healthcare. And I feel like when you feel empowered to say, okay, wait, there was something wrong with my body, and then I did the research and changed how I was living, and then I fixed it, that'll ultimately make you feel empowered to fire a doctor if you feel as though they're not giving you what you need at the time. So I don't know what your question was, but that's what you got. Sorry.
No, you answered the question. I think that ultimately, I think, the system, it's one thing to complain about the system, right? Mm-hmm. But then it's one thing to be an active victim where you continue, where you put the power in the hands of the people that might do a good job. And because like healthcare workers are fantastic. Like this episode is not a diss to people who work in our healthcare system.
Not at all.
Like the people who make this thing run are saving lives, saving babies, saving moms. And the work that you guys are doing is greatly appreciated. So thank you and everybody else who sacrifices your time and energy and all the things you do to pour into people. However, that being said, it is a system that oftentimes leaves people left not worse off than they were when they came, but it doesn't treat the root of the problem. And so ultimately, I think to summarize everything you just said was we as individuals have to take control in this relationship between ourselves and the system that we're hoping to get care from.
Yeah.
We have to go to the doctor once a year. We see specialists. We take, medications or supplements. Mm-hmm. Whatever the case is, I think ultimately coming from a healthcare professional, someone who works in healthcare, she is saying that it is still ultimately your responsibility to take ownership of your health. And then by taking ownership, it puts you in a position to better advocate for what you feel like you need.
Yes, because you are an active participant in your healthcare.
That's it.
You're not just a recipient. And that's actually what we're taught. We're taught to respect the patient's autonomy. Autonomy is just the ability for the person to make choices and decisions for themselves when presented with information. Mm-hmm. So that's literally what we are taught, to support you in making the best decision for your healthcare. And the providers are taught to come up with a plan together with you, mm-hmm. Together with you to
get your results that you're looking for.
Yeah, together with you. No, that's what I'm saying. So they're together with you instead of to you. Mm-hmm. So it's healthcare with you, not at you. Mm-hmm. And that's really important. You just remember your power. You are a participant in your healthcare. You're not just a recipient of healthcare. Mm-hmm. I think, yeah.
Yeah. Okay. Well, shoot, man. I think that we covered what I set out to cover. Despite health disparities, despite the undertone of systemic racism that we do experience in this country, and this is not us like dropping a victim card, but I think that it's us saying, hey, listen, like we have issues in our society, and if we don't speak about them and have these types of conversations, then we can't count on them to be fixed, and then people will always end up falling victim to the issues that many of us are too afraid to speak of. Yeah. But yes, the power is in your hands. Vivian, do you have any final words, thoughts, like things that you think would make the world a better place? Like anything on your heart that you want to drop on the people?
I think ultimately it's just remember it's you. Mm-hmm. It is you. You are the reason. You're the reason why healthcare providers like myself, healthcare professionals like myself, mm-hmm. Go to work, and why we strive to provide excellent care, even within a system that we realize is broken. And we try to, despite what we see, give the best because of you. And I just want you to remember your power. Remember your power outside of the healthcare system, the changes that you can make, because you are what you believe of yourself. So yeah, like you're not a victim. You are an active participant of the care that you choose or choose not to engage in. But with that being said, let me tell you about Earth Belly.
I was just about to ask you about that. Let me tee you up properly.
Okay.
So yes, Vivian is a healthcare professional, but she has passions of her own that she has shared off camera, and she would like the opportunity to tell you guys a little bit about that. So yes, let's talk about Earth Belly. What is that?
So we know a lot about the disparities facing Black women, as far as like pregnant women and women of color, but specifically in this country, Black women. And Earth Belly seeks to connect women, all women, not just Black women, but connect all women with doulas and midwives in their community to support a birthing network that can exist with outside of the hospital space. Of course, we need the hospital if there's an emergency situation. Definitely. If we need the hospital, it needs to be there. But there are women who do want to have births at home. There are women who just need access to more information surrounding birth. And we have a lot of wonderful women leading that cause, especially here in the state of Georgia. But Earth Belly seeks to be another piece of that puzzle and bringing women together with the resources that they need. So look out for us.
Look out for Earth Belly. You can find it. Give it maybe like 2 months.
Yeah. Give me a little time, and then I'll have some tangible platforms for you to engage with.
There you go. 2-3 months. You can find Earth Belly on IG, TikTok, YouTube,
Patreon.
Yes, and outside of that, I think Vivian, you have a gift. Like, there aren't too many people that can speak with like the level of passion that you do. So outside of Earth Belly, I encourage you on record to like know your power. You know what I'm saying? And step out and be bold, which you've already done, because this was gonna be anonymous. But then she was like, "Nah, put my name on it.
Put my face on it.
Put her face on it." So you've already taken that step. But man, I know so many people that would like. I'm gonna show you. We're gonna clip up some of this podcast, and they're gonna be like, "Yes, that's it." Keep doing that, because there's just too many cases of women, Black women, who don't understand what all their options are, especially when it comes to giving birth.
Yeah. Thank you. I really appreciate you saying. I needed to hear that. Thank you for saying that.
So we're gonna hold you accountable, me and the entire Culture of Health community. We're gonna be looking for Earth Belly. I don't know. Vivian, thanks for joining me.
Thank you so much for having me. It was great.